My background is in education. Some of you may know me from the Winston School as the Director of Diagnostics there for 22 years. And then I could not pass up the fabulous chance to work with Dr. Evans, who I've known for almost 20 years now. And so I've been at Children's for 5 years now and love it. And it's offered wonderful opportunities, not only to work with a kind of a different group of children and families, but also the research aspect of it has been incredible. So in the clinic, I do a lot of screeners. I'd love to do full evaluations. We see a lot of kiddos, so that's almost impossible on top of the research. So hopefully when we do move over to the Center for Autism and Developmental Disabilities, I'll have more of a chance. But we are doing full evaluations currently now at the center. There we go. So here are my disclosures. Dr. Evans has already talked about the book. That was a great experience, and pushed each other along with that. And then our support here. Okay, and then I'm not only going to talk about the academic and social challenges, but also go over educational laws, services, your roles as in assisting these families, and then resources. And we have developed, I think, a wonderful comprehensive packet of resources that are out there somewhere, but in a packet from us, it also has information about how to get a hold of us, not only at the center, but also at Callier. Okay, so first we're going to talk about this. I added quite a few of these pictures later after my first run through. So I think he's so cute. All right, so children with academic challenges for children with autism, as we talked about, that runs the gamut on cognitive ability. So be very low all the way to the very superior range. But oftentimes they have the splinter skills. And so they have difficulties there, and difficulties, you know, when you think about in the classroom, following instruction, beginning, sustaining and completing work, not being distracted by their peers. I think a lot of it is about executive function. So, you know, they have difficulties with memory, attention and concentration, time management, management of their materials, frustration tolerance. So all those areas affect these children. And of course, the difficulties with abstract concepts and generalizations that we typically see more of as they move to the upper elementary levels, middle school and high school. Okay, so we all know, you know, some of these kids are very obvious with the social difficulties. We had a family yesterday where the mom and grandmother were in with the sixth grader, and they said, but he loves people. He doesn't know a stranger, and he wants to join in. He wants to be everyone's friend, and so we talked about, you know, okay, well that's fabulous. He's very interested in other people, but can he sustain a relationship? And that's the kiddo that I call the unsuccessful extrovert. You know, he wants to be out there, he wants to interact, but he's not successful in maintaining those relationships. And part of that is, as Dr. Rollins, a lot of that, as she noted, a lot of that is communication based. Okay, so, you know, another thing is they have a lot of difficulty with abstract language. So sarcasm does not work. Figurative language, you say it's raining cats and dogs. What in the world does that mean? You know, so they have great difficulty with that. They can be the fringe kids that are on the fringe of the play, that they're just observing, or they have absolutely no interest at all. Or they can do the parallel play, or just be unsuccessful in their social situation. So certainly, you know, having those social skills, the social skills training is very helpful. Also protecting these kids in these situations because they tend to be victims as well. Okay, so, and sometimes we feel like this. Sometimes I feel like this. Okay, so educational laws, can be very confusing. These are the current educational determinations, and we don't say diagnoses in education. And just because, they differ, and just because you write that the child has ADHD or autism or whatever on a script and you hand it to the school does not necessarily have to provide services. They have to determine if that is helpful or not, or if that indeed, the keyword, affects educational performance. Okay, so in 1990, a new public law was passed, and it added the autism and traumatic brain injury categories to the areas we serve. And this was the diagnosis of the definition by IDEA, the Individual Disabilities Education Act. And a lot of it is very similar to the DSM, but the key, whoop, I didn't mean to do that. There we go. Let me get my pointer. Is it has to adversely affect a child's educational performance. Okay, and so someone had talked about earlier, how does a school diagnose a child with autism? Well, it's in a multi-specialty system. There's a licensed school psychologist, an educational diagnostician, and a speech and language pathologist is part of that. Hopefully they've been well trained in testing children with autism. Many of the larger school districts have autism teams and can provide excellent evaluations. So we talk about some of the things we see with these children in a school setting is the repetition. We see them outside the school setting as well. Repetition, the stereotype behaviors, resistance to change, and sensory processing issues. And I believe the sensory processing issues is going to be entered in with the DSM-5. Okay? Okay, so, and then of course they will not diagnose a child with autism if there is emotional disturbance. Okay, so when I was saying earlier that in 1990 they added autism and traumatic brain injury into the educational determinations for services. And I know we've seen several different formats of this graph, but I wanted to look at it one more time because people say, goodness, it just exploded. Well, the reason is in 1990, when we pass a public law, it takes a while to get it going. And then in 1993, schools had the option to report cases of autism. In 1994, they had to. And so in 1995, we have this giant surge. So before that, we had this pie of kiddos in special ed that were really just labeled under mental retardation. And then when we got the autism and the TBI determinations in there, those pieces of the pie came out and the numbers rose. With that, we had to improve our diagnostic assessments for autism. Teachers had to now these kids were always covered under special ed, but we had to develop special ed or autism trained teachers, specialized programs. We had to get more tests and better tests out there. So it wasn't an epidemic, but there's reasons why the numbers have increased. Okay, so programs for children with autism spectrum disorder. So we have early childhood, and we were talking about that earlier, and it's very important if you have given the MCHAT and the child has failed, and you send them to ECI, is to put that diagnosis of autism on there, because that is an automatic in, okay? And so the sooner the better. They will not test for autism, but they will provide some of those services, behavioral services, along with the speech. So that goes up to age 3. Part of ECI will also be to transition them over into special education, to help the families get to special education through the PPCD program. Okay. In our handout, we have information about how to contact ECI and quickly how easy it is to find just using a zip code. Okay. All right, and then IDEA can be from 0 to 21, if visual and hearing impaired, all the way through. Most schools will age the kids out at age 18, but some can keep them up to age 22 for services. I want you to notice that currently more than half the students with autism are served in self-contained classrooms. That might not mean the entire day, but for core classes. And then Section 504, I kind of think when it deals with our children with ASD, it's really looking more at the children with Asperger's or high-functioning autism that just need some modifications and accommodations. So here's ECI. These are the services it provides. Okay. ECI comes to the children's home. It will come to their daycare and provide services there in the child's environment. Helps families learn how to deal with their children with the specific issues, whether it's feeding, behavior, speech, play. And so they'll deal with that. It's never enough. You know, it's only a couple of times, if you're lucky, a couple of times a week. More so it's once a week. But hopefully they also help the family learn how to deal with these children also. So that can continue. Now, PPCD. So what can happen in PPCD? As I said, you know, some school districts have incredible evaluative teams to diagnose these kids and provide service. Now, some PPCD programs are half a day, some are full. Some kids who just need speech will come for a couple hours a week. And something you'll see, and it might be a little confusing when the parents bring back the school records, if they do, the evaluations, you might see something called NCEC, non-categorical early childhood category. Or early childhood, non-categorical early childhood. That's a place marker. They did not feel like they could truly diagnose that child with a specific determination. So usually that covers either autism or what we now call intellectual disability. And it will, once they get closer to age 6 and they're reevaluated, then that diagnosis will come off and they'll determine another determination, whether it's intellectual disability or truly autism or something like that. Speech impairment almost always goes hand in hand with these kids. So I think every school record I get, it's autism, speech impairment. Okay. So how do you help get these kids services? And so, of course, you know, the screening tools, the MChat, I don't know how many of you do the ages and stages, but that also, some of the other tests that Dr. Evans was discussing as well. We would suggest, and we do have the resources, that developing a resource sheet or list for your patients in your area, you know, whether it's Collin County or Dallas or Denton or wherever, if you can have a list of places that do provide ABA or speech, the support groups, who they can get a hold of, a lot of that will be in your resource package you'll get today. So certainly, and we've done this, I think we beat this one to death, is early intervention. And so why it's so important. But I think, you know, there's so many reasons. We have so many parents, as well as I'm sure you do too, who come in, and I just think as parents you naturally go to the place of guilt that you didn't recognize it early enough, or you don't know what to do about it, or you don't have funds to provide your child with all these services. So certainly that's something we all deal with. And again, as we talked about, building a resource list for the families. The Ages and Stages has a great resource list that gets printed out along with the completion of the test when you score it. So, or it comes with it that you can print it out. So that's always a good idea, and it's age appropriate. And then we have lots of groups out here. And certainly with the autism area, we have lots of support groups in all the different counties. We have an incredible Fragile X group, and I think they're so strong because they're the one and only. And so I think like ADD, ADHD, and LD, all those have, branched out to the different counties or suburbs. But Fragile X is they're just one big group, and they're really strong. So, and then of course, genetics. So then we do have great genetic specialists in the area that can be helpful. Autism Speaks, we've talked about this. They have a wonderful website. And someone was talking about adult services. Actually, Autism Speaks has a lot of information on there about adult transition. And so I would recommend going there. The 100-day kits are fabulous. And it's not only for autism, but it's also for Asperger's and high-functioning autism. It is usually within 6 months of being first diagnosed. Typically, of course, we'd want it right then. It is a big packet. It is free of charge. They can go online and download it. But something else, if they don't want to do that, because I think it's over 100 pages, it's a big packet. They can also call Autism Speaks. There's a number on there, and they get a free one printed out. They can also, Autism Speaks can also send the request over to any FedEx, or I guess it's certain FedEx offices that will print it out for them there free of charge. So that's something to suggest. So not only Autism Speaks has great information, Fragile X, National Fragile X Association has great information that can be used either way. We're working on a document right now about school alarms, about fire alarms, safety drills, things like that, how upsetting it is to our kids. So the Fragile X Consortium is developing a letter to provide this school. So that's another one that can certainly be used back and forth. And then, of course, the AAP has the toolkits for autism as well, for the diagnosing and the resources for that, the webinars. And it says, family handouts, English and Spanish. Autism Speaks also has handouts in Spanish as well. And many of our tests are now in Spanish. So I know GARS has a Spanish version, Basque, Connors. Thank goodness we have a fabulous language interpreter in our office, because I have to take it to her and ask her, what have they written down? I mean, I can score it when they circle the numbers, but they write down things too, and I don't know what they're saying. But thank goodness we have an assistant. Okay, so as Dr. Evans said, so many times families don't know how to approach a school about how to get their child served. And this is just some highlights of the letter. It's actually in the resource book that you can get. And it's something I developed as part of our book and in the resource section. So, there's some of the highlights. The family needs to be very clear. They're asking for an evaluation. If they have been evaluated by a PCP or someone else, a psychologist, somebody else, they can talk about what that diagnosis was and include that report. I think it's always good if you can make it happen for the families to actually meet with the special ed director and talk about their concerns. If they can't do that, I would suggest that they create a document that talks kind of a timeline of what has happened with their child. It's really important also to if the family has had the child receive therapies, they paid it out of pocket. Documenting all of that is really important. Sometimes the schools, sometimes report cards, especially for the young ages, will show that everything's fine, but then the parent will report, that's not the sheets I'm getting, the paperwork I'm getting, or that's not what the teacher's saying. So documentation is really important. Here on this slide, it talks about basically documenting. You want to prove you have provided this to the school, you've requested. There are guidelines on that. In fact, another item in the resource booklet is a timeline for special ed. When you request it and what occurs along the way and what their timeline is. And knowledge is power for these parents. So we have this wonderful family that we see all three. Dr. Evans sees all three of the kiddos. And the family is so good about documentation. In fact, they bring that rolling crate in every visit, and they've got all the files in there, every ARD, every FIE in there, and it is really helpful. They don't have it labeled quite, so you have to go through it, but oh my goodness, we so appreciate their due diligence in providing us with the information so we can help their child. And here is a sample letter. If you felt obliged to write a letter, I've got also some items on the next slide about writing on a script. But just stating this, what you're requesting from the school. And I was reading this last night and realized that you might not want to put this in there. That sure, call me. Call me anytime. And, that could probably go away. But if you are going to speak with them, then you need to have the parents speak with the school. And, of course, you need a release form signed by the parents. Otherwise, you just hand this to them on your letterhead. That should get the ball at least rolling. And it would be really powerful if the parent wrote their letter from the previous slide and added this as well. Now, if you want to do the shortcut method, here are a couple ideas for your prescription pad, and just requesting a comprehensive evaluation and stating clearly that they have been diagnosed with ASD and you'd want a comprehensive educational evaluation. Okay, so here's our contact information. It's also in the resource section, our resource booklet. And also in the resource booklet, all these different things, the national, state, local advocacy groups as well. Okay, this is one of my favorite slides. And it was actually, I'm an adjunct professor at UNT, and I taught a class on autism. Actually, Dr. Evans was my frequent guest speaker. And this was a grad class, and this is actually one of the students' children, and took the picture. And I just love that picture. I think it just says so much, and I love how it's just arranged in size. And once he got it where he wanted, that he could go to sleep. He's so cute, the red hair. Love it.